I'm Dr. Malik, intensive care specialist. Usually I hear from relatives that what happened to particular person, relative. They say that one of his heart valves got damaged, so it was stented. They have put a stent in it. So they are using they don't know exactly what is happening in the heart. What is an artery, what is a valve? They are unable to differentiate between valve and artery. So I just want to tell you what is an artery, what is a valve. Just look at this. This is heart. This is heart. Outside, I have not done it. This is a complete heart, and this is the aorta. The major blood vessel which comes out of heart is aorta. See, while the aorta is coming out of heart pumps its blood supply into aorta. Just before coming out of the heart, it gives about two branches, right coronary artery, left coronary artery, and left coronary artery beginning itself, there is a small branch called circumflex artery. So the main thing is, these three vessels, mainly two vessels, right coronary artery, left coronary artery, and circumflex artery. These are the three arteries which supply the whole heart, which give blood supply to the whole heart. Suppose something happens to the right coronary artery or left coronary artery or circumflex artery, if they get blocked, one of them get blocked, two of them get blocked, or three of them get blocked, you will get heart attack. And these are the blood vessels where we put stents inside. So this is a separate, total three coronary vessels, two major, right coronary artery, left coronary artery, right coronary artery, left coronary artery, and circumflex. These are the three main arteries in which stenting is done. They will put a stent inside. So you must understand that these are coronary arteries which supply blood to the heart muscle. The total blood muscle and everything inside the heart is blood supply is through these small arteries, which are three. You must understand this. This is related to heart attacks. Then we'll come into what is valves. What is exactly valve? I will tell you. See, when you cut the heart like this, so there are four chambers in the heart. We all know that there are four chambers in the heart. Upper right chamber, upper left chamber, right lower chamber, left lower chamber. These two are atria and these two are ventricles. We know that. So upper right chamber, left upper, right lower, and right lower and left lower. So there are some valves which only allow the blood supply one side. For example, left upper this atrium. From this, if blood has to go into the left lower one, there is one valve called mitral valve. And right side, if right upper part to right lower part, if the blood has to go, then there is another valve called tricuspid valve. It only allows one side. Only one side. It can only go like this. It cannot go reverse. Okay. This is mitral valve. This is tricuspid valve. Again, I told you this is a very big artery. This artery. If the blood has to go from left lower part of the left side of the heart into this blood vessel, there is an aortic. This is aortic valve. This is aortic valve which pumps, the heart pumps through aortic valve into the aorta. It doesn't come back. And again, from the right side of the heart, there is another valve here called pulmonary valve from the right side of the heart. Pulmonary valve which supplies into the lungs. This is to the whole body, whereas this goes to the lungs. This is called pulmonary valve. So there are four valves: mitral valve, tricuspid valve, aortic valve, and pulmonary valve. Four valves inside the heart. These are the valves which, one, mitral valve, two, tricuspid valve, aortic valve, and pulmonary valve. Four valves. These are concerned with pumping of the heart. When the heart pumps, it should pump only one side. Now, the blood should not go back. No, it should not leak. So, in case the valves get damaged, suppose mitral valve gets damaged, or tricuspid valve gets damaged, or aortic valve gets damaged, or pulmonary valve gets damaged, there will be leakage of the blood backwards, and naturally this leads to heart failure. So we can replace these valves. This valve can be replaced. This valve can be replaced by artificial valve. Any valve, all the four valves can be replaced by artificial valves. So this is another surgery that is called mitral valve replacement, tricuspid valve replacement. These are valve replacement surgeries, and they have nothing to do with heart attack. They have nothing to do with heart attack. Valve replacement surgeries, it is just like, and you can do valve replacement surgeries or temporary valve dilatation procedures, all these things, and they have nothing to do with heart attack. So heart attack is not caused by this mechanism. Only thing is, if these valves get damaged, you are likely to develop heart failure. Heart failure is likely to develop, and we must be it is very clear that this is concerned with heart attacks, and this is concerned with heart failures. So once again, we should remember that if the heart attack is severe and it is not treated, it can go to heart failure because heart gets damaged. So we must understand these two are different.